Thank you, Mr. Chairman. Let me begin by first thanking each of our witnesses today for their expertise, their dedication, and their hard work. Dr. Redfield, I want to start with you. I am hearing from dentists all over the state of Maine that the fact that they cannot practice in our state, despite following very strict infection control protocols, is causing growing health problems. Dentists tell me that teeth with cavities that could have been filled are now going to need root canals. Teeth that could have been treated with root canals are now going to require extractions. People with oral cancers cannot get the treatment, the cleanings that they need before beginning their treatment. Dental health is clearly so important, and Maine state officials, as well as our dentists, are seeking assistance in reaching the right decisions. 47 other states either have reopened dental practices or have a date set for them to reopen. So my question to you is this. If dentists are following the American Dental Association guidelines, if they're instituting strict protective measures for their patients, their staffs, their hygienists, themselves, and if they're closely examining and seeing a decline in the number of COVID-19 infections in their county, are these reasonable factors for states to consider in reopening the practice of dentistry?
Yes, Senator, thank you for the question. We've been interacting and talking with dentists and working with the state and local public health officials to update our guidelines on reopening a variety of medical services, as you know. And I think you raise a very important point, and I would not disagree with what you said about looking at the American Dental Associations as well as the reality of the outbreak in the area. But we are in the process of updating those guidelines, and they will include direct guidelines for dental practices.
Thank you very much, Doctor.